Hello, members. Tom Morrison here live from Nashville, Tennessee at the MTI home office, but I'm not actually at the home office. I'm at my home adhering to all the in-shelter stuff we've been going through today. It's not an exciting thing to be talking about, but we're in unprecedented times, and what we are excited about is we're able to bring you resources live so you can do the things that you need to do in your business to be able to withstand the storm that we're hearing. And today, we're going to hit the FMLA Emergency Paid Sick Leave Act and the Family First Act that you've been hearing about in the news so much. We have Chad Sorenson from Adaptive HR Solutions, who's going to be with us. And we obviously have as a guest here today, Jim Oakes from Super Systems, who are our president of MTI. And I wanted Jim on the line because Jim is going to tell us a little bit about what the leadership of MTI has been doing the last couple of weeks. We've been meeting weekly as a team with Don Hendry from Pinson Valley, Jim Moore from Pentaflame, and Jamie Jones from Solar Atmospheres, along with Jim Oakes. And we've been really looking into the developments on a weekly and daily basis to see what do we have to do as an association to help meet your needs, to help you muscle through this incredibly challenging time. So Jim, welcome to Heat Treat Live today.
No, thanks, Tom. Thanks for having me, of course. So, yeah, what I want to do, I'm just going to briefly just let everybody know that we've been spending a lot of time reviewing the situation that we're in and determining what we can do that's providing resources and information to our members. Tom and his team have gone through and put together some industry information. There's a coronavirus resource on heattreat.net that gives you access to some of the things that we've been able to produce, act quickly on, just the Essentials in Business letter or a survey of the MTI members, just getting a feel for how they're feeling about the situation that we're in. And of course, when this whole thing happened, the first thing that the group wanted to do is answer questions as things are moving so fast. I think everybody that's engaged in this is realizing that every day is presenting another curveball or another challenge, and it's really tough to navigate. So we are doing our best to deliver resources to the membership through the webpage, and then of course daily information that's being produced not only by Tom and his team, but also by other members asking questions to the membership, and hopefully you're getting that information and getting that feedback quickly. So I just wanted to say that, let you know that we're all working on that. We're in contact actually, probably more than weekly. Tom and I were talking as late as Saturday night, going through some things. So it's important to everybody. This is some strange times, and everybody could certainly use the help of the membership and the people that are going through it. So with all that said, I'm going to go ahead and turn this over to Chad. This is going to be great to hear what he has to say about some of the things that are changing, that are new laws that are in place that absolutely are going to impact our businesses.
Well, Jim, real quick before we go to Chad, I wanted to ask you. So, I mean, I think you mentioned that we did a essential business letter.
Yes.
To really share with members. It's out. If you go to heattreat.net, members, and click it, it's right there in the big box in your face. It says coronavirus resources. Click here. One of the top links you'll see there is an essential business letter the executive committee came up with that you can show to any federal or state employee that you're an essential business and what that's defined as and why you should be able to remain open. And Jim, I think it's important for members to hear from you, one of our members, as to why is this, another step of that is why it's so important to contact your supply chain up and down. So I had 3 or 4 members call me and say, I had some of my customers asking me, are we still in business? I want to encourage members on the listening to this to be proactive and reach out to your members while you have a little bit of time on your hands and really let them know that if you are or not in business. So what's the importance of that, Jim, as you look down that?
Yeah. You're right. I kind of briefed over that, and it's a really important resource that we put together. When you read through the state laws and some of these things that are being enforced upon us, what is essential business? You would recognize that the things that our membership does is important to fundamentals across many businesses that absolutely are essential, whether it's medical, Department of Defense, transportation. I mean, if you think about getting goods from one place to another, they are all parts and pieces that get heat treated. And we're fundamentally a big part of that supply chain. So we need to let our customers know. I mean, we did that. We reached out to our customers, and we've had members asking the same question: are we still in business? Well, the answer is yes. Use this resource to reach out to your local governments. I mean, we're the state of Ohio tonight shuts down at midnight. We are essentially part of that essential business. And we have letters from our customers, including the one that MTI produced, which is justifying why we're in business. We have to comply with just the hygiene and some of the other stipulations that they put in place to make sure that we create a safe working environment. And we'll have a number of people that are telecommute. But at the end of the day, for producing our products, we are in place because we feel that we are essential to the supply chain and to business today. And all of our members are. So reach out to your customers, let them know, provide them with this letter, letting them know that we're part of the essential supply chain, essential businesses, and that you are in business and you are ready to do whatever they need when it comes to the processes and manufacturing processes that you do.
Yeah, because I don't think members realize what might come through their doors. The quick story on that is last week I got a call from a member who told me a story about he got a call, I think it was Thursday last week, from a supplier that said, "Hey, are you in business?" He's like, "Yeah." He says, "Well, within the next few days, you're going to get 3,300 parts that are coming that go on ventilators. And we need them heat treated in the very first furnace you can open up and stick them in and get them out and get them back to us," which is obviously ventilators are one of the most demanded things that we have right now. So you don't know. So I think that's why it's important to let your customers know you're in business, you're essential, and your staff to be able to handle that work appropriately. So thanks for that, Jim.
Yeah, you bet. You bet.
So Chad, let's move into the big federal response, the big bill they're looking at, and what that means from a paid leave act, HR responsibility. So can you just give us a sense of, first, just introduce yourself and let members know you spoke at our 2017 meeting in Bermuda.
Yes. I think a lot of people remember because I was the guy who talked about marijuana out there, and there were plenty of questions that happened.
That there was, for sure. So give members a little background of who Chad is in 30, 40 seconds.
Sure, absolutely. So I've got an HR consulting company, leadership development company that I've had for 12 years. I focus a lot on small, medium-sized businesses, anywhere from 5 employees to 1,200 employees, anywhere from blue collar to white collar to a mix in between. So a lot of the challenges that employers face are the ones that I'm dealing with on a regular basis. I'm also one of these advocates or government hounds that I'm always following legislation, knowing what's going on in Washington or here in Tallahassee for the state of Florida, to know what's happening out there that will impact employers. And I often advocate on behalf of employers, both in Tallahassee and up in DC. So I've been following these laws quite clearly and quite closely. So the one that we're here to talk about today is the one that actually passed last week. It's HR 6201, which is the Families First Coronavirus Response Act. And there are 3 important parts. There's a bunch of different aspects to this, but there are 3 important parts that I want to make sure that I just kind of briefly touch on. And then I know Tom has some questions, and if you guys have questions as well, we want to make sure that we answer the questions that folks might have regarding this. So there's 3 important parts. First is paid emergency family leave. So a lot of you might be familiar with the Family Medical Leave Act. And if you are 50 employees or more, you already have to comply with this. This now, however, adds 2 different components. First, it goes down all the way and it applies to employers with 500 or fewer employees for this additional qualification. And it also adds a paid component into it. We've not had a paid component in the Family Medical Leave Act, but now we do for this one portion of it. So if you have even 1 employee, this could cover you at this point. And basically what it does is it adds a qualification for this leave that says that if you have and I'm reading some of this because I want to make sure I get it right. If an employee is unable to work or telework due to a need to leave for care for a son or daughter under the age of 18, for that son or daughter because their place of school or their place of care has been closed, then we have to provide this emergency leave for them. And what this means is that, and there's a bunch of technicalities, but in the first 2 weeks, we don't have to pay them. But after that, for the next 12 weeks or for the next 10 weeks, for a total of 12, we have to pay them 2/3 of their pay, up to $200 a day. So this is a new component that has been added in, and it's something that we have to make sure that we're still following, and that we have to learn how we have to process this, how they have to apply for it. All of this, by the way, is going to be coming out in the next week and a half. The law was passed last week. It goes into effect April 1st or April 2nd, depending on which day that you calculate it from. And from that date forward, we have to follow this law. So that's the paid emergency family medical leave. And there are other components that I'll talk about in a second. But in essence, if someone is out because school is closed and they have no other options and they have to be at home, then we have to provide up to $200 a day in terms of compensation, with certain limits for that.
Chad, quick question while you're
Yes.
right there. So what happens to the person that is out prior to, like they were out starting last week or this week? What happens to someone that's out prior to the act starting?
Normally what family medical leave says is based on the date that they would qualify for the leave. If they are already out, but then they subsequently qualify, they qualify at that point. So they would then be covered under that leave. If they're out right now, you're still going under what your normal attendance policy is. However, given the circumstances, I would not be very aggressive in terms of looking at that and saying someone's out and you've missed too many absences and now we're going to terminate you. Because the risk of a suit that happens afterward, knowing that this leave is going into place, would be too great.
Mm-hmm.
So let me move on to the paid emergency paid sick leave.
Hey, real quick, Chad, I
yes.
just want to let people know, if you go down to the bottom of your screen, people listening, and you hover at the bottom, you should see a thing, option to see chat. It'll pull up the chat box to your right, and you can type in any questions down there you would like to ask Chad or Jim or myself, and I'll be monitoring those and can ask those in. I just want to let people know where the chat box was, so go ahead.
Perfect. So the emergency paid sick leave. First, to note, this is in addition to any sick leave, vacation leave, or PTO you already have on the books. This is something that's new and added on there. And basically what it says is that there's, for full-time employees, they get 80 hours worth of emergency paid sick leave. And for part-time employees, it's the average of what they would be scheduled for a 2-week period. And there's a way to schedule to calculate the average, but it's what they would be. So if they're a 25-hour-a-week person, they would get 50 hours worth of emergency paid sick leave. So this leave covers, again, employers with fewer than 500 employees. And with this, there's 6 different qualifications that they can apply to get this leave. In 3 of them, you have to pay them 100% of their pay, up to a maximum of $511 per day. And for the other 3, it's up to $200 a day, and again, only 2/3 of their pay. So when they wrote this law, they wanted to make sure it was as complicated as possible. But if we take a look at the qualifications, for the full pay, there are 3 things, and basically it has to do with the employee. If the employee is subject to a quarantine or isolation order related to COVID-19. So for example, if they traveled out of the country and they came back, and the standing order for their area is that if you traveled out of the country, you have to be isolated. That's covered. If they are told by a government because they have been in contact with someone who has COVID that they have to quarantine for 14 days, they have to be quarantined for that time frame. Second reason, if they have been advised by a healthcare professional or provider to self-quarantine. In other words, they talked to the provider and the provider said, you need to stay home for the next 14 days to ensure you don't have this illness. So at that point, they then are eligible to stay at home because they can't work, they can't come into the office, they can't come out into your facility or plant and be able to do anything. So that's another one. And finally, the last one is if they're experiencing symptoms of COVID-19 and they're seeking a medical diagnosis. So they can't just sit at home and say, I have a cough and I think I might have this and not do anything about it. But they have to be seeking a medical diagnosis. Now, how do we prove any of this? That's going to be the tricky part. And the law even states that proving a lot of these things is going to be harder than normal, just because of the workload that's going on. Some of this will have to be taken on faith from the employee. But at other times, if they go see a doctor, they'll be able to walk away with a piece of paper that says, I was here and I was told to self-quarantine. Sometimes it might be an email coming directly from a doctor's office, might be something like that. So those are the first three qualifications: is they're quarantined, they're advised to self-quarantine by a healthcare care provider, or they're experiencing symptoms and seeking a diagnosis. Now, there's three other qualifications.
Chad,
Yes, sir.
so those are for up to full pay or up to $511 per day, right?
Yep, for 80 hours, which is really 10 days worth of pay, and that's it. So for the other three, if they're caring for an individual who's subject to the first two, in other words, quarantined or being told to self-quarantine, so they're caring for someone. Now, oftentimes we think about family members because the Family Medical Leave Act talks about that. A lot of other things talk about it. They changed the terminology in the final bill. Instead of saying family members, they say individuals. So it's not just a family member. So make sure you don't make that a qualification. So if they're caring for someone who is quarantined or is told to self-quarantine. The other one is if they're caring for a son or daughter who's out of school because the school's closed or the child care facility's closed. So the final one is the Department of the Secretary of Health and Human Services could come up with something else, and they just put a catch-all in there for that. Someone has asked me, or actually a bunch of people have asked me, so if I have to pay them for up to 2 weeks for the time when they're staying at home for a child, yet the new Family Medical Leave Act says that I have to not pay them for the first 2 weeks, how do those two things jive? That's a great question, and I hope the Secretary of Labor will answer that question in the next week, because there is no answer, and no one will give you an answer because we don't know what the answer is. Unfortunately, some of this stuff, we just have to go with the flow. Now, what happens? Now, all of a sudden, I've got to pay out all this money to these employees, add 80 hours of paid time off, add 10 weeks of paid time for someone who has to stay home with a child. Well, first, there's an incentive to not stay home if it's with a child because they're not getting their full pay. So hopefully they'll be coming back. The second is the third part that I want to talk about today, and that's the tax credits that you're going to get for any time that's being paid out. So for the time that you have to do for the Paid Family Medical Leave Act or for the emergency paid sick leave, you'll receive a dollar for dollar credit against the Social Security portion of FICA that you otherwise would be paying into the federal government. So you have to track that. You have to know why someone's gone, how you're paying them. And because of that, you'll then be able to take a credit on that. And if you don't owe as much as you've had to pay out, then you'll be getting a refund from the government. Don't ask me when, because well, we'll just leave it there. But so there are a number of different components to this. I'm not going into great detail in terms of the tax credits because how that's going to happen has not yet been decided. And that's going to be your accounting side and your CPAs who will figure that out. However, I will tell you this, effective the date that it's supposed to happen, I wouldn't be paying someone for this before the effective date and expecting a tax credit on there. I would wait until that date. But effective that date, you'll want to also make sure that you code their pay appropriately. I would set up a COVID-19 pay code for employees. And frankly, I would do one for FMLA and I would do one for the emergency paid sick leave, because that way you'll be able to track dollar for dollar all your expenses, or at least your tax creditable expenses for COVID-19. And it'll be easier on the back end when you then have to apply that. Also, documentation, you need to make sure you keep that documentation in place so that way you can get the credit. That's just a very quick general overview of this 112-page bill that was done, of which 3 sections truly apply to employers.
So a couple of questions here coming up on the chat
Yes.
line. So each state, so are you expecting each state to come up with their own spin on this? Because one of them is in California here, says that they already have Family Medical Leave Act. So would they look to go over and above the federal bill potentially in any given state?
Some states could, and let's start with this. What I'm talking about is a federal law. So the federal law also states that if you have a local or state law that trumps this or is more expansive than this, then you need to make sure that you're following that law. Also, some of these laws could be interacting with each other. So if your state has come up with something, you definitely want to check with your employment attorney in that state to make sure you understand how the state law impacts what's being done on the federal level.
Gotcha. So one person wanted clarification. So we're going to need to be paying all employees who have to be quarantined?
Yes, if you're still in normal operations. I've had this question as well. because I've had one of my clients have to lay off 80% of their workforce today because they're in the medical industry, but it's not an urgent medical industry. So they're only taking emergency patients at this point. So what they did was, if they're laid off and they're no longer working, then this law does not necessarily apply to those people who have been laid off. But if they otherwise would be working and otherwise would be scheduled, then yes, we have to pay them when they have to be quarantined. Remember, the quarantine is really only up to 2 weeks worth of time. If they get symptoms and they're sick, then yes, they're out sick. But keep in mind, the emergency paid sick leave only applies for 80 hours or 10 days worth of work. Someone else asked me, well, then what do we do if they're out and they're sick for 4 weeks or 5 weeks? Well, if you have 50 or more employees, or at your state level, whatever they require, then the regular Family and Medical Leave Act would apply. That's unpaid, but there's still job protections that are in there, just like those job protections are here for the emergency side of things that have been added in.
So what about the employee that's furloughed? I mean, a lot of people are not laying off. They're either laying off or they're saying, well, you're furloughed, which pretty much means they're coming back at a certain point in time in the future, which says they're still kind of employed, but not employed. What's the distinction there? I mean, does that play at all?
They're no longer scheduled to be working. They're no longer expected to be there. And a temporary layoff and a furlough are very similar in terms of what we're looking for. They're not terminated. And that was a big question that someone else had, was what do I do about PTO? Do I have to pay out all their PTO when I lay them off, or when I temporarily lay them off or furlough them? In Florida, and again, this might differ by state, but in Florida, there's no law that says that you have to pay out to a laid off or a temporary laid off or a furloughed employee. Instead, what we've come up with is unless your policy talks about what you do for a furloughed employee, then you are simply not putting them on the schedule for a period of time. And we're looking at it 2 weeks at a time, 3 weeks at a time. We're revisiting every couple weeks. You can decide what you want to do. I wouldn't necessarily recommend that you pay out an employee's PTO all at once, because at some point here, they're going to come back. And at some point before the end of the year, remember we're at the end of the first quarter, they're going to want to take some time off. And if they use all their PTO, all their available PTO now, and they have nothing for the rest of the year, now you're going to run into issues later on during the year for that employee who wanted to have something later on.
Okay. Another one typed in says, what happens if we have less than 50 employees and our company does not have any sick days?
That you get to have now sick days, because you now have up to 10 sick days. So there's a part in the law that says, because it goes all the way down to even less than 50 employees, for the emergency paid sick leave. By the way, the Emergency Family Medical Leave Act also applies to employers that are less than 50. So these go all the way down to 1 employee. Now, there is a portion in the law that says that if this would prevent the company from, let's see here, the exact language says that small businesses with fewer than 50 employees can be exempt from these requirements when the imposition of such requirements would jeopardize the viability of the business as a going concern. So what are the definitions of that? That hasn't been decided yet. Of course, it says that. So at least they put something out there that says, yes, we're going to have to deal with this. However, they did say that small businesses, it will put them out of business because they frankly have zero funds to be able to pay this out. That would be jeopardizing them as a going concern.
Right. So I got one question here. I want to make sure, I hope I get this right. It looks like it's kind of in bits and pieces, but if an employee is required to isolate because of state mandate, but his company is deemed an essential business, which one takes precedent?
The isolation, and that's because it's a public health thing. Because if they come in and they infect everyone else, even if you're an essential business and you have everyone who's sick, whether you're an essential business or not, you have no one working there.
So if someone's deemed to be isolated, they need to isolate.
Absolutely. And here's one of the things, we talk about the business and we talk about the needs of this. And I wrote a letter for a client right before this call that said, we need to continue to take care of our clients. They are one of the ones who are in this critical infrastructure workforce in the United States, or the essential workforce. But they're one of these that we also said, we need to service our customers and our clients. But we also need to take care of your own health, safety, and welfare. And we want to make sure that you are taking care of yourself. It's kind of like when you sit on an airplane, not that any of us are doing this now, but you sit on an airplane and they say, if the oxygen masks drop down, put it on yourself before you help anyone else. Because if you pass out, you can't help anyone else. So the same thing, even if you're essential function and essential in the business, but you have to isolate or you're self-quarantined, that takes precedence because it is a public health emergency.
Mm-hmm.
Now, there are certain positions or certain people that can be exempted from that, such as first responders and healthcare professionals. However, if they're sick, they're not going to be exempted from it because they can't come into work sick. They could be exempted from being allowed to use the leave for a child not being able to go to school. However, if they're or caring for someone else. However, if they're sick and they got to be out because you don't want that there.
Right. So a couple things on the finance. So one of our members asked, I guess, let's see here. Can owners of less than 25-person company use the 2 weeks federal pay?
Can owners? If you're an employee, all employees can do that.
Okay.
I don't believe there is a restriction in the law. As I try to remember 112 pages, I don't believe there's a restriction that says owners cannot partake in that.
So did you mention a couple of categories that the $200 a day
Yep.
applied to? So one of our members want to know the last two categories listed, were those also included in the 200-day max payment?
Yep, for the emergency paid sick leave, it's basically the full pay, and 511 is if the illness is dealing directly with the employee. The $200 is if they're caring for someone else, if they're out because of the schooling issue, or whatever other category the Department of Health and Human Services creates. Those would be the $200 a day. And by the way, the $200 is 2/3 of their pay or $200, whichever, it's capped at $200. So think of it this way also. The max in emergency paid sick leave that you have to pay for an employee under the categories 4, 5, and 6 is $200 a day, which is $2,000. The max you have to pay to an employee if they get sick because of emergency sick leave is $5,110. It's 10 days times 511.
Right. Okay. So let's see, I'm looking through here. So a couple of owners wanted to kind of dig in a little bit to being safer at home and in the workplace. So if an employee wants to isolate because of safety but have no symptoms and the company is essential, can they stay at home? Any pay regarding that if they choose to want to stay at home?
Nope. There's nothing in the law that says that because I'm afraid or because I don't want to get sick, I'm going to isolate at home. There's nothing in the law that says that they can do that.
Okay.
Instead, rather, they either have to be sick or caring for someone who's sick. What happens then? Well, then your normal attendance policies would prevail. And either they're taking PTO because you allow it, or because this is a business emergency, your essential services, you have to treat the heat treat the parts for the ventilators that have to go out, and you need to be fully staffed to do that. Then you can say, sorry, no PTO is allowed since we're under a public health emergency and we're essential critical infrastructure. Whatever decisions you make, have a business justification for them.
Sure.
And treat people equitably across the board. Equal is always hard. Equitable, in other words, having a good business reason for doing that is important.
So, so two things on the April 1 date and if you paid out money before April 1 to employees, are those eligible for reimbursement?
Probably not.
Okay. And on the same sense, one of the owners said, am I correct in assuming that all employees laid off before the law goes into effect, that their exposure is zero related to the payment requirements?
That is our position right now, unless the Secretary of Labor comes back and says this is retroactive, but the bill doesn't say it's retroactive. So if they're already laid off and they're not working, they can't take emergency leave because they're already not working. They're not scheduled. They're not a part of the workforce, even if it's a temporary furlough. Now, the Department of Labor might come back and say otherwise. So that's also critical to make sure that everyone understands, is that we're still waiting on guidance on how this will be implemented. We know what it says, but we also, in terms of timing, in terms of retroactivity, in terms of process, in terms of requirements for proof of need, all those type of things, they could come out with requirements that say otherwise.
Gotcha. So
But the general consensus among all the law firms we've looked at, by the way, I'm not an attorney, I'm not giving legal advice, but the law firm's consensus have really just stuck with what has been in the text of the bill, and interpreting that to the degree that we can until the guidance comes out from the Secretary of Labor.
So one of our members saying, regarding the emergency leave, how does the law handle employees caring for children if both spouses work?
That's a conversation that doesn't. Normally, when in Family Medical Leave Act, there's no requirement that it's only one parent or another, unless, of course, they're working at the same company. Then there can be some requirements. However, this is absent of that. But if both parents are making a lot more money and they both decide to stay home during that time, they're going to be making significantly less money.
Right.
So part of the reason that it's only at 2/3 is because there's an incentive to make sure we get back to work. There's also a rock and a hard place. A lot of people use their parents, the grandparents of the children, to watch them during a time when they've got to go to work and the kid's sick. We don't really want to do that right now,
Right.
particularly with the elderly population, because they are more susceptible to the coronavirus.
So what about the employee that calls in sick on Monday and he says it's that, and he's gone through Friday and he comes back the next Monday with a doctor's note that says, I was definitely out for this. I mean, is that a payable issue?
Yeah.
As long as they have medical documentation.
Right. And the requirements for documentation, when they wrote the bill, they even said in the bill that it's going to be difficult to get all the documentation we normally get. We're going to have to do a lot of this on the faith of what on the word of what the employee says. The one side of it that I looked at was, well, it's in the end, it's going to be the government that's reimbursing for this. I think the biggest thing is communication with the employee, and communicating with them now, and let them know that, we're essential. We have to keep operating. The things we do are critical. Our customers still need us and their customers need them. So that's why we're here and that's why we're doing this. We're going to take your health and safety into account absolutely every single time, and it has to be a priority. And if you're sick, take care of yourself. If you can, whatever you can do to get here to work, please do that. Because the other option of going home and being on unemployment or whatever it is, unemployment doesn't pay a lot.
Right.
In Florida, the max is $275 a week.
Right.
I mean, most people, they go from where their salary is to a little over, $15,000 a year. It's going to be a big shock for them.
Yeah.
To all of a sudden only have that income. So to work with them, to communicate with them, we're in this together. I mean, you see a lot of ads on TV now that even say this. We're in this together. We got to work together to do this. It should be the same relationship we have with the employees there, is to make sure they understand, hey, we're in this together. We're trying to figure it out. And by the way, whatever we say today may be changed tomorrow.
So let's talk about some issues that could be related to basically connecting with the employee and the employer. So is there would they be smart to post anything around their company, just like you have the FMLA postings and the workers' comp? Is there anything that you feel like they should be posting so it's out there for everybody to definitely see? Anything they should be communicating up on a screen for people?
There actually will be a poster for the emergency paid sick leave. The Secretary of Labor has yet to put that out, but there will be a poster that all employers must post at their workplace. The other thing that I would do is to let employees know what your plans are right now. That was the memo I wrote today. Here's our current operation plan based on today, the 23rd of March. This is what we're doing. Here's how we communicate with our customers. When you interface with them, here's what we want you to do. Here's how we're restricting the person-to-person contact in-house. I mean, these are people who visit residential homes on a regular basis. So the work orders and everything else are going to be left in their trucks for the next day. When they come in and they're done, they're going to leave all their paperwork in their trucks, and then they're going to collect the paperwork the next day. So we're even reducing the interface that a technician has with someone who works in the office on a daily basis. They're leaving it in the truck so that face-to-face, that no contact transaction. A lot of food delivery services are doing that now. We'll leave it on your doorstep. We'll text you when it's there. You then go get it, so we don't have this face-to-face less than 6 foot interaction.
Right.
But communicate with them and let them know The only requirement for posting is going to be for the emergency paid sick leave, and that will have to be posted. They're going to provide a model notice, so it's probably going to be a PDF poster that we send out everywhere. I'll make sure you get it. You'll be able to put it up on the website.
Awesome.
But we'll be able to, that's the only poster that has to be out there. But I'd put out a communication plan and say, hey, talk to us if you have questions, if you have concerns. Let's have a conversation.
So do you think it's important to do it more in little teams, or would you say as a company, because some of our members have 5 employees, some have 50, some have 100. For the ones that could do it, would you just recommend them get them all in a room together at some point in time to say, look, this is where we are. This is what we're doing as we go down the road. This is our communication plan, and kind of give them the scoop in one shot and keep them abreast?
Well, if you have 50 employees, don't bring them all together, because then we're over the 10.
Right.
So,
true. Good point.
I mean,
yeah, that's why we have you on the call.
I mean, literally, that is part of it. You
Yes.
shouldn't be having meetings with more than 10 people. And wherever you can, even if you got 10 people in an office, do a Zoom meeting with everyone sitting in their own office,
Gotcha.
as opposed to bringing everyone together. So
Good
those
point.
are things. I know that you sitting there. How many grandchildren do you have now? How many you got around you at any given time?
12, so 2 are outside.
Okay, there you go. So at least you're practicing that social distancing there. But think about it everywhere else as well. Maybe it's managers going walking, or maybe it's putting it out there, or maybe it's having all your employees call into a line. Not everyone has access to video, so
Right.
maybe it's them all calling into a line. So you as the CEO, or you as the head of HR, or whoever you are, general manager, can get on there, can talk to everyone, and let them know if you have individual concerns, come talk to us and have a conversation with us. But I'd put it in as a memo, I'd put it out, and I would make sure that you don't use facts that, imperial facts, or things that say this is what it's going to be, because tomorrow you have no idea what it's going to be. If we take a look at where we were a week and a half ago, we're a completely different country than where we were a week and a half
So
ago.
no absolutes on a daily basis.
Absolutely not any absolutes.
Right. So let's talk a little bit about essential business steps. So in a manufacturing plant, you have essential business, which is people who are putting the parts together and heat treating them. And you have office people. Are office people, administrative workers, considered part of the essential plan, or would they say, no, the admin work can sit on the sidelines? You got to produce the parts, but the paperwork going behind it, that's not essential. So is there a level of essentialness?
It's not essential today, but if this goes on for 6 weeks, it's going to be essential, because the company's going to need to get paid by the company's going to need to get paid in order to be able to continue doing that. So you might be able to scale back. You also might be able to take a look at folks who are in the office and say, who can do this from home? Who doesn't have to be regularly in the office? So that's also a great way for social distancing. It also is a way to, because when we take a look at the law and we talk about, what's considered there, it says that they can't work, nor can they telework. So they're going under the assumption that a lot of folks can telework. And it's amazing how many employers can find ways to all of a sudden have their employees work from home, be able to call in, be able to, I almost said dial in, we don't dial up anymore, but be able to connect on the internet back into our servers at the company. So all of a sudden, when push comes to shove, we can find ways to do that. Depending on how long this lasts, we may need to find ways to be able to do that. Or if you're like California or Ohio starting tonight, or New York, where all of a sudden there's a mandate where it's a stay-at-home mandate, except for essentials. Yeah, I work for a company that's essential, but am I essential in the company?
Right.
We have to take a look at that. And where we can, let them work from home.
Well, a big part of that, everybody listening, is that a part of having remote workers increases your cybersecurity issues. So one of the things you want to make sure you put on your calendar, go to our heattreat.net and click on the resource page. And about a third of the way down, you'll see it's actually the third webinar being held this week on Thursday. It's going to be an hour-long webinar that's going to hit solely on that fact of remote workers. What are your cybersecurity issues you need to be looking into as you make that bigger? So go out there and look at that, and you'll get an email Thursday morning as well to sign up for it. So another big question that came up. So what is an employer's rights and opportunity to test somebody temperature-wise if they see them coughing, to test them in any way they want to see where they stand? What's the owner's liability or rights in that?
Well, first thing I'll say is that all the laws are still in effect. all the privacy laws, all the ADA, Americans with Disabilities Act, all those laws are still in effect. However, because this is a national emergency, because this is a pandemic, because this is a health crisis, certain things can be done that you normally wouldn't do. So the first question that I usually get are, can I check my employees to find out if they have a fever? Based on where we are right now, yes, you can. But take this into consideration. Checking for a fever is a medical examination. You can do a medical examination on an employee after they have a conditional offer of employment. So let's just talk about the fact that all your people are working right now. So they are already employed. So you can do a medical examination, which is taking someone's temperature. But keep in mind that you have to maintain that as confidential and private information. You can't have it just laying down on someone's desk, or when people walk in, you see everyone else's temperature on a chart. You can't do that. Also note that temperature is only one of the symptoms of COVID-19. Don't fall under a false sense of security because someone has a 98.6 temperature, because they may have other signs or conditions. It's one of the symptoms. So you can look at that and take that in the partiality that's there when you have to look at the total of this employee. So yes, you can do that. Yes, you can ask them if they've had symptoms. Yes, you can ask them where they've traveled in the past 14 days. Getting to the point where in another week, no one will have traveled internationally, or for the most part, not. And you can ask them if they've been in contact or close proximity to someone who has been diagnosed with COVID-19. So you can ask those questions, but remember that the laws are still out there and we still have to do the appropriate thing with it. But the ADA actually, or the EEOC actually put out a document that talked exactly about this, of what you can and cannot do with employees. And they got an FAQ that they put together that really just kind of outlines what I just said, but in a little bit greater detail. So yes, you can test employees, but remember, all the laws we have are still in effect. So whether it's how we pay employees, what we pay them, the questions that we can ask them, those are all things that we have to be careful about how we do it, but we absolutely can, given the fact that this is a pandemic and a medical emergency.
So let's take it one step.
I was going to say, Tom, just if I can add to that, one of the things that we did, because the guidance was given by the state of Ohio for temperature taking prior to entry into a building. So what we've asked is that we're not going to take on that responsibility, but we're going to tell everybody to do it at home. So they are required now. I don't know how many people are doing that, but we're trying to protect the safety of the others, and that's why we did that. And in the spirit of what the state of Ohio has provided for guidelines. So if they have a temperature, they're not allowed to come work. If they show any signs, we can ask them to leave. And that was part of the policy that we put in place right from day one, when this thing got a little bit crazier than normal.
So let's dig down a little bit. Thanks for that, Jim. So let's dig down one step further. So you got an employee who's in a high-risk category. Are you able to direct them to self-quarantine and self-isolate, and they'd be covered under the Paid Leave Act?
Unless you are a healthcare provider, that doesn't come under there, because they need to be told by a healthcare provider to do that, or they need to have symptoms and they need to be seeking medical diagnosis.
So you can't arbitrarily, they're in high risk, push them off or self-direct them. They have to be in those categories.
No, because you could also be violating their ability to be able to do their job. Under the ADA, you have to provide reasonable accommodations to an employee. Under the Pregnancy Discrimination Act, you have to let a pregnant employee know, here are the risks, but you can't tell a pregnant employee they can't do something. They have to do that, otherwise you could be discriminating against them. So making them aware of the risks, absolutely. But even if someone is in a high-risk category, they have asthma, they have heart disease, one of a number of different high-risk categories. Even if they're in that, you can't tell them, no, you can't come to work. You might suggest that we work from home, and you figure out how to allow them to work from home. But you have to be careful about emphatically telling someone who is not symptomatic that they can't come to work.
Okay. So, which leads to, you're an essential business, and you've been told that you do have someone that tested positive that was working at the plant. What's kind of the steps you feel need to be taken at that time?
First, make sure your health department is contacted, and you talk to the health department about what steps that you need to take. Now, I've been chatting a lot on the national HR SHRM blogs about what to do. And someone said they contacted the health department and they gave us no guidance. Great. Glad to hear that. Contact another health department and tell them you're in that area. No, I'm just kidding. No, actually, that might be a good idea. You might find one that will communicate a little bit better. But what you want to do is people who are in close proximity to that, they're already going to ask this question. Who were you next to over the past 14 days? Who were you near? Let people know that someone has been diagnosed. We also have to be very careful about how much information we give about an employee, because we still can't talk about that employee to other people.
Right.
However, given the health crisis and given the situation that we're in, there's a little bit more leeway. But what you communicate to your employees and how you do that, it's important to make sure we understand what we can and cannot say. So
Right.
if you have that specific situation, I would recommend talking to your local employment attorney to say, how can we communicate with the employees about this person who is sick, and what can we and can't we say to them as the employer? But let people know, hey, someone who's here has been diagnosed. The people who were in close proximity, in a meeting with them, who were had lunch with them, whatever it is, have been told who the person is. But it's more on an as needed basis, need to know basis of
Right.
letting folks know who it was and the fact that they were exposed. And for some of those folks, they may need to self-quarantine because they remember, oh man, he was coughing all over me.
Right. So what about the family member that has a family member that definitely was diagnosed with it? You don't know when they last visited. Some doctors are telling family members, if you've got a family member that was diagnosed with it, you need to self-isolate as well. If that, I mean, should they, or does that fall under the
that falls under number 2 for paid leave. Employee has been advised by a healthcare provider to self-quarantine.
Even if it was just that your dad was diagnosed and you were around them, so you need to. Okay.
Because the doctor told them to self-quarantine.
Gotcha. Okay, gotcha.
So
that's
go ahead.
So I was gonna say, so that's the key. No matter how you connect it or whether you have it or not, if a doctor said you need to self-isolate, that's the key function.
Yep.
Okay.
Yep.
Gotcha.
Because you're subject to an order that's a standing order that's out there for quarantine or
Right.
isolation. A doctor told you to do that, or you're experiencing symptoms and you're seeking medical diagnosis. You know, and some people may say, "Well, this is crazy. This is too much. You know, how are we going to be able to continue to operate?" Well, the other side of that is really, if we don't get this under control and we don't do these drastic measures, this will last for months and months and months. If we really hit this hard over this 2-week, or maybe it's 3, or whatever the time frame is, don't ask me how long it's going to last. No one knows. But however long this time frame is, if we really hit it hard, we'll be able to tamp this down more quickly. But if we play fast and loose and we say, well, but you're really essential and I really need you here, but they truly were exposed, how many more people are they going to infect? And then all of a sudden, your essentiality drops because you can't do the job because you got no one working there.
Right. Right. Man, as you can see, this is like question after question. I mean,
absolutely.
There's a million different situations, which is really, we still got about 12 minutes. So one of our members is, if in order to increase social distancing, employees are requested to move to another shift, but refuse, would this be handled as a normal HR situation, or would they be eligible for Emergency Paid Leave Act for FMLA?
They would not necessarily be eligible for either one of the emergency paid leave or FMLA. You are scheduling their shifts, and you are doing it for a reason of social distancing. I've got one group where they have technicians that come into the office, and all 15 technicians were coming in at once. Well, they've separated them, so it's 7 to 8 technicians at one shift, and an hour later or a half hour later, 7 to the other 7 or 8 then come in for the next one. So this is a good way of practicing social distancing, is by rescheduling. There's no law that says that you have, well, okay, time out. Other states may have a law that says you have predictive scheduling that has to be out there, and you might have penalties if you change that schedule or do other things. Now, a lot of these laws may also say that in emergency situations, when things happen, that you might have an out for doing that. So this is an emergency situation. This is one of those where a lot of those clauses come into effect, where it's, things that happen beyond our control. This is where, when you sign a contract for an event where you have a force majeure and you have, if the government says you can't do it, well, guess what? everyone got out of there is because the government said no meetings and no gatherings over 50, and now it's recommended at 10. So the law for predictive scheduling, which is in effect for many states and a number of municipalities, you have to take a look at that as well. Because remember, the laws aren't out the window, but there may be an out for this type of situation. But in the question that was asked there, if they refuse to go to another shift, then they're refusing to work.
Okay.
And it falls under the fact that they're refusing to work.
Okay.
Again, this is the communications and this is the relationship. And this is where we want to have that good relationship with them so they understand why we're doing this. Now, they may say, but I've got to take care of my child because my wife is working this shift and I need to work this shift. We need to take that into consideration as well. And again, be careful with the absolutes, but instead try to figure out what is the best way to do this. And sometimes they have to be on that shift.
What about visitors coming from outside? A lot of our members have, not the FedEx guy, but a lot of our members get audited by third-party entities. They come in, they spend 2 to 4 days. They're looking at every ounce of their operation to deliver a report back to the auditing body. And you don't know where they've been. And some of them are even foreign nationals. So, I mean, how do you go about dealing? I mean, some people have, shut down and said no visitors whatsoever. So what's the kind of the right steps to take if you've got visitors coming from outside that are kind of essential part of your business, but it's not?
That's each governing body, whether it's the whatever organization it is that's doing that. Part of it, a lot of those folks, they've cut down unessential travel. Only essential travel has to happen. But there are industries, the meatpacking industry still has to have FDA oversight, still have to have, or USDA, and make sure that people are coming in to make sure things are still functioning right. You can still ask the same questions. Have you been out? Have you been in contact with someone? Do you have a fever? And you can go through those. And if they say yes to something, you can say, okay, stop. You can't come in here. Well, you have to let me in here. So then you go above their head and you talk to someone else to say, wait a minute, they're presenting with symptoms and they want to come in and infect my entire workplace. I'm sorry, that's not going to work out. And you can say, have you been outside of the country in the last 14 days? And ask those type of questions. Because remember, when we take a look at this, and one of the reasons why we're able to do a number of these things is because OSHA's general duty clause. We have a general duty to provide a safe work environment for our employees.
Right.
It is our responsibility and our duty to ensure that people who are coming into the facility are doing so safely and we can bring them in a safe manner. If we can't, then we have to put up a red flag to say, if I allow you in, I'm going to violate OSHA's general duty clause. So when push comes to shove, again, it's about communication and be important for that association, the quality association or whatever it is, to know, hey, by the way, this person's sick and they're trying to come into my workplace and I can't allow that to happen.
Well, I know the person that asked that. I can say to everybody on the call or on the webcast, I know that NADCAP and ISO have sent out communications to all their people that they audit and that are qualified, and they're making headway to reschedule things, moving further out.
Yeah.
I know NADCAP has waived their $3,000 rescheduling fee that they normally charge if you want to reschedule. So there's a lot of steps being taken in both NADCAP and ISO to try and really meet people in the middle to get that done. So if you have any issues with that stuff, please feel free to email me at tom@heatree.net and we'll try and help you work through that. But I know they're trying to work with people to get audits so that they're practicing the social distancing themselves. So a couple more quick questions here that pop up.
Yep.
One of our members just said, I can't wait to get back to heat treating. I think we all agree on that, right?
I can't wait to get back to leadership development instead of just figuring out how to explain a 112-page law that we don't know about.
And we're only on page 2, right?
Yeah, exactly. Something like that.
So the last two that I think I haven't really covered in any way is I've seen some instances where employees of my wife's boss was diagnosed with COVID-19. How should this situation be best handled?
First, your wife needs to talk to her healthcare provider to say, here's who was diagnosed with COVID-19. Here's my proximity to that person. Do I need to self-quarantine? And if the healthcare provider says yes, okay, what about my husband? Well, if you two are sleeping in the same room, it's probably a yes as well, because you are, very much exposed, just like she was. So if she gets it from her boss, and she gets it, and you've been sleeping in the same room with her for the past 4 days until his diagnosis came in, then you've been just as much exposed to her as she was to him. So really have to take that in consideration. And it's those instances where I say, don't be the healthcare provider, and have them talk to their healthcare provider, explain the situation, and find out what they say, because we don't want to get into the business of doing medical diagnosis, because that could be very bad for you.
Right. So leading up to that, a company has a shift who had a COVID-19 diagnosed person on that shift at any point in time. What should the steps be for that operation? Do they basically, that shift has to shut down and those people quarantine for 14 days, or what are the steps they should really look at taking?
I think what they need to do is again, bring in talk to a healthcare provider about what they say about the risk of exposure to everyone else who is around that person. Part of it has to deal with, are they right next to the people who are there all the time? Or are they in this part of the plant and the other one's in this part of the plant? They happen to be on the same shift. Some other ways that you can make sure that you're being careful about this, don't have people eat in the break room. Have them scatter, have them eat outside, do something like that. Don't congregate in the break room. People can come in and use the microwave, or they can come in and get a soda or something like that. Make sure those things are being wiped down on a regular basis. Make sure things are being cleaned out. Buttons, knobs, doorknobs, light switches, make sure all that's happening. But encourage social distancing as much as possible. In some plants and facilities, it might be easier than others. But whatever you can do is, first, let's prevent it by making sure there's enough distance.
Right.
If you need to stagger when people come in, and we're going to do shifts, and we're going to have people coming in and clocking in and doing everything in 15-minute increments, then let's do that. Wait in your car until it's time for you to come in, and then come in at that time. So that way we keep people spread out as much as possible. But if you've got one person who's sick on the shift, there are so many different what if scenarios that what I would do is get a healthcare provider to give you a suggestion, either Department of Health or that person's doctor or another healthcare provider that can come in. It might be an occupational health person that can come in and help with determining how many people truly do have an exposure and how many people should be self-quarantined. And that's the whole reason why, if someone's sick, stay home. You know, my director of marketing today said, I woke up with a sore throat. Guess what? Stay home. I don't want you here. Stay home. And she's working from home. She's doing everything from home. So there's not a problem. My guess is she just slept funny last night and she's got a sore throat and she'll be perfectly fine tomorrow. But if someone here starts to have symptoms, I want to be very careful about what I do and who I'm interacting with, which is why most stuff that I'm doing right now is this way, instead of going to go meet with employers in-house.
So the last thing I want to hit on real quick, because I think this question came up, I think it was answered earlier, but I think it bodes well clarifying again, is the employee does not want to work based on what is happening. They're not sick or have symptoms. We have not officially laid them off. So we just take them off the schedule. However, when we start laying off, do we include that person? So you have someone that, just don't want to work because they feel unsafe, but they could work. I think that needs to be clear to members. What are your steps when you just have people who say, I'm unsure, unsafe, feel unsafe being in this plant?
Your normal attendance and PTO policies hold true for that person. Okay. Because nothing in the law covers someone who just doesn't want to come into work.
Right.
Because they feel unsafe because of the situation. One of the things you can do is talk to the employees, and this is why communicating with them proactively is important. Let them know the steps that you're taking, how many times you're cleaning doorknobs and light switches a day, how frequently are things being wiped down, cleaned, everything else. Let them know the steps you're taking to help to make sure that you have as safe as possible work environment for them, and make sure that communication's there. But if you still might get someone who wants to do that, well, then your normal attendance and your normal PTO policies still take effect because they're not covered under anything else. If you have to do layoffs, you're going to do business justification for the reasons for your layoffs. When you have to choose, who am I going to lay off? These are temporary layoffs, and that's what I'm telling employers to tell them. Right now, it's a temporary layoff. I've got some that are paying them for the 2 weeks they're laying them off. I've got others that aren't paying for the 2 weeks that they're laying them off. Someone said 2 weeks. Is that it? No, that's where we are right now. And in another week and a half or 2 weeks, we'll let you know where we are then.
Right.
Because these stay-at-home orders may be expanded. may stay the same. We just don't know where we are. We're dealing with it 2 weeks at a time. So we have to take a look at what we're doing with PTO, what we're doing with benefits, what we're doing with pay, and then make sure folks know you can apply for unemployment. Don't ever guarantee what a state's going to do for unemployment, but let them know they can apply.
So one of our members said, well, what if you're okay with them taking time off? I'm sure if that's the
That's
case,
fine.
then you just let them go and communicate the same things that you just
Absolutely.
said.
Absolutely. You know,
Awesome.
that's where your normal policy goes into play, and you're afraid you want to stay home, you're going to use PTO or you're going to do it unpaid. That's fine. Just make sure that you don't discriminate against one group of employees or against employees, and
Right.
that you have business justification for the reasons that you're doing what you're doing. A, we really don't need you right now, or your work can hold off for the next few weeks. If you allow someone to do it, be careful about saying, sure, for as long as needed, or I'll send you home and I'll pay you for as long as, you know, this goes on. If this goes on for 6 months, are you paying them for 6 months?
Right.
Again,
Well,
absolutes, be very careful about them.
Chad, our 1 hour, will the company still have to pay medical insurance if you, oh, that's a big one.
Yes.
Let's take just a couple minutes. I know this is going on our hour, but benefits, we've talked a lot about pay. Speak to the world of benefits, of what happens when you lay them off, or what the different scenarios.
Sometimes that's directed by the state and what you have to do with the state. There's nothing at a federal level that talks about how long you have to keep the benefits going on. Your normal benefit plan will stay in effect unless you're terminating an employee, or unless there's a provision for layoffs or for furloughs. What most of the employers that I'm dealing with have decided to do is they're communicating for those that they're laying off that their benefits, for right now, we're looking at it today and beginning or at the end of March, you're going to be covered all the way through the end of April. Later on in April, we're going to make decisions as to where we are and what's going to happen. Again, talk with your benefit broker to find out what your options are. Some plans have a little bit more flexibility than others. Some states require certain things to happen, or for the length of time. Because the other thing I want to just quickly mention is that there are WARN notices that may have to go out, and there are many WARN notices. So a WARN is the Worker Adjustment Reemployment Notification Act, I think is what it stands for. But anyway, it says that if you have a certain percentage of a plant or facility that you're laying off at any given time, you have to give 60 days notice for that. Except in the case of an emergency where it was unforeseen and things happen. By the way, we're in that exception period. However, some states also have mini WARN notices, which means that it might be a smaller amount, or the state requires a separate notification. Please be sure that if you are laying off folks, you look at those notification requirements and you let them know. But no, in most of those cases, the exemptions hold true. So it's the same thing with benefits. You can decide what you want to do. Most of the employers I've talked with right now are, they're basically already paid through April. And so they're just continuing them through April, and we'll have the conversation later on next month.
It's funny that you make those comments, because the next question that came up was, since WARN is suspended currently, are there any best practices we should be aware of when we're laying people off? So is there anything else you'd want to elaborate on that?
Just make sure that you take a look at the state requirements, or even municipalities. They sometimes have those, and they may not have an exclusion clause, or they may have other notifications that still have to happen. There's a lot of flexibility that's being provided out there. Just know what the law says about each one of those.
Well, that's awesome. Well, Chad, that was, man, so informative. That was like a rapid fire lightning round of questioning and stuff. So we want to thank you. Is there anything going through my last thing that you'd want to say to members that are listening to this?
The biggest thing that I told two folks this weekend were communicate with the employees and let them know that you guys are all in this together. Let them know what your intentions are, but don't be absolute. I dealt with one group. They had to lay off 80% that I mentioned before of their workforce. Let them know that, hey, we're doing this so that way we can survive, and because we want to make sure that we're doing the right thing. And our own industry association said only emergency procedures are the things that we should be focusing on now, so that way other healthcare professionals can focus on where they need to be. So the same thing with your employees. Let them know they're essential. Let them know that you care about their health and welfare, what you're doing for them, and let them know what their options are, and that sometimes you don't have an answer today, but maybe you will tomorrow.
Awesome. Thank you, Jim. Mr. President, what would you like to say to the members out there listening in?
Well, first of all, thanks, Chad. That was fantastic. I've had an opportunity to sit through a couple of these, like I think other members have as well, and it is changing rapidly, and the absolute component is nerve-wracking, honestly.
Mhm.
So, but thank you very much. The only thing I'll say is that the MTI board and the leadership is doing what we can as far as getting information out there. Go to heattreat.net, look at the resources that we have. Just taking the poll of the recent MTI members information related to COVID-19, 10% are saying they're not very concerned, 28% are somewhat concerned, and 62% are very concerned. That's just a quick poll that MTI did, just checking in with our membership. But along those lines, there's a bunch of resources out there. Talked about best practices for cleaning the workspace. We have the links for the other two webcasts, which are going to happen on the 24th and the 26th. Tom mentioned one before. And then there's other key links to the CDC website, to NAM's website, to the OSHA for workers and employers. So, and if we get the information that the posting for the family leave for the sick, FMLA, SLA, the sick leave component, we'll get that out there and we'll post that out for the members. So we're doing our best. If there's some other information that anybody that's in attendance here would like, please let Tom know, and we'll rally what we can and get everybody.
Awesome. Well, Jim and Chad, members, I want to say this to you. It is no question that we're in a tough time, right? Tough period. But what I want to encourage you with is everything I read and hear and listen to says that it's not if we get to the other side, it's when we get to the other side. And because this is a health crisis, not a financial crisis, that the recovery should be pretty brisk and come back pretty quickly. It might take a little bit of time to get steam, but it's going to come back. I want to encourage you to fight, fight, fight. Keep your employees whole. Keep them excited, give them hope to the future, and you stay hope, because when we get to the other side of this, we're going to make it together, and you got MTI running the gauntlet with you. So stay positive, let your be the calm in the storm for your people, and stay tuned into whatever we're providing you so that you can have the information you need to know to get to the other side. You get to the other side, it's going to be good times. So just fight, fight, fight every single day. And I'm here personally. You email me at tom@heattreat.net. and send me anything that you need information on. We are here to help you because, my friends, you're not just strong, you're MTI strong, and I say that to you every time. So, Chad, thank you so much for your time. And members,
Absolutely.
Thank you for your commitment to MTI, because our goal is your safety and your success, and we're looking forward to getting through this with you together. So everybody, safe being, and we'll talk to you soon. Have a good day.